How's it going, folks? Can you guys hear me okay? All right, happy Tuesday. Welcome back. And today we are going to start and finish a chapter. Today we're going to go over chapter 11, which talks about the cardiovascular system. And we are going to finish this chapter today, which means that the quiz for chapter 11 is open right now, in fact. And you're going to have until Sunday night to take the quiz. Okay? So new chapter finished. The quiz is going to open. Just to remind you, our next exam is next week, Tuesday. So next Tuesday, we have our third exam. So we are a week away from the third exam. Okay. All right. So let me share my screen with you. And let's talk about the heart and the blood vessels. Now, guys, when we talk about the cardiovascular system, cardio is in relation to the heart, while vascular is in relation to the blood vessels. Okay? So we're going to start with the discussion of the heart. We're going to talk about the anatomy of the heart. We're going to go over the chambers of the heart. We're going to go over the heart valves. We're going to go over the great vessels of the heart. And then after we're done with the anatomy of the heart, we're going to discuss about the physiology. How does a heart beat? What is the process? What happens during a single heartbeat? And then finally, we're going to go over our blood vessels and finish the chapter today discussing about hypertension or high blood pressure, which is what we call the silent killer. Now, why is hypertension a silent killer? It is a silent killer because we don't feel anything. You might have hypertension right now. We might have high blood pressure, and you don't know it. Unless you check your blood pressure, you wouldn't know that you have hypertension. Nevertheless, the damage is being done to our body, and we're going to discuss more about that today. Okay? So let's start from the basic here, folks. Where is our heart? That is not a tricky question. If you ask anybody to put their hands over the heart, they're going to put the hand over the left side of the chest, right? Well, not quite. Yes, most of the heart, about two-thirds of the heart, is on the left side of the thoracic cavity, as we can see right here. But we still have about a third, one-third of the heart is actually on the right side of the thoracic cavity. So it is not true to say that the heart is positioned on the left side only. Okay? It does have a portion of it on the right side of the thoracic cavity. Now, our heart sits between ribs number 2 and number 5, and it is found within a space within the thoracic cavity that is called the mediastinum. Now, very important here, mediastinum is not a membrane covering the heart. Mediastinum is a location within the thoracic cavity where our heart is positioned. Okay? Now, our heart, together with the lungs, they sit right on top of the muscle called the diaphragm. And the diaphragm separates the thoracic cavity from the abdominal pelvic cavity. If you take a close look at the heart, guys, we can see that the heart has a triangular shape to it. And just like any triangle, we're going to find the apex and we have the base. The apex of the heart right here, it is pointing towards the left side of the body. This is the left, this is the right. While the base of the heart is pointing towards the right side of the body. Why do we care about that? Folks, we care about that because we need to be able to divide the heart into two halves. Because a lot of the structures of the heart, they are bilateral. And we need to know what is the right side of the heart, what is the left side of the heart. Now, how do we divide the heart into two halves? Well, let me show you. What we're going to do is that we're going to pass an imaginary line that is going to go from the base is going to pass through what we call the interventricular wall, and then it's going to exit through the apex. Just like that, guys. So this side right here is the right side of the heart. This side right here is the left side of the heart. When we look at the heart from an anterior view. Okay, and I'm going to go over that several times with you to make sure you understand what is the right and left side of the heart. Now, our heart is covered by a double-layered membrane. We have discussed about this before when we talked about the cavities in the body. And this double-layered membrane that is surrounding our heart is what we call the pericardial membrane or the pericardium. And because it is a double layer, one layer is touching the heart itself, and we call that the visceral layer right here. And then we have another layer that is covering the walls of the cavity, and we call that the parietal layer. So we have the visceral layer, we have the parietal layer. Now, in between here, what we have created, guys? We have created a cavity, a space. This is what we call the pericardial cavity, which is filled with what? It is filled with pericardial fluid. Okay? All right, so now let's take a look at the heart wall and see what the heart wall is made of. And if I take a little slice of the heart wall and I amplify it, just like what we have right here on the screen right now, we can see that the heart wall is divided into three different layers. There is an inner layer, a middle layer, and an outer layer. The inner layer is what we call the endocardium. Endo means inside. So inside of the heart. In fact, this layer right here, the endocardium, is going to be covering the wall of the chambers of the heart. Okay? The middle layer is the thickest layer right here. This is what we call the myocardium. Myo means muscle. This is the muscular layer of the heart. And then the outer layer is the epicardium. Epi means around, surrounding. So this is the layer on the outside. Okay? So we have endocardium, myocardium, and epicardium. Now, this epicardium, folks, it also happens to be the visceral pericardium. And we can follow the visceral pericardium right here, and we can see how it's going to fold on itself and become what? Become the parietal pericardium or the parietal layer. In the middle, we have a cavity, which is the pericardial cavity filled with pericardial fluid. And these are the layers of the heart wall. Okay? All right, so let's take a closer look at this beautiful little heart right here. And we're going to see that we have four different chambers inside of the heart. So let's slice open this heart and take a look inside. There we have it. Now, before we name the chambers, let's split the heart into two halves, guys. With me here. How do we do that? We're going to pass an imaginary line from the base. The line is going to go through the interventricular wall and then exit through the apex. There you have it. This is the left side of the heart. This is the right side of the heart. Okay? So now we can name the chambers. We have a right atrium, left atrium, right ventricle, left ventricle. Now, these chambers right here, each one of them, they have a specific function. So let's see what are the functions of each one of the chambers, and let's see what are the blood vessels that are going to bring the blood in and out of the heart. And these major blood vessels that we're going to be discussing right now, they are what we call the great vessels of the heart. So the great vessels of the heart are big, big blood vessels that bring blood in and out of the heart. Okay, let's focus on the right atrium first. And the right atrium, it's gonna have two major blood vessels, one attached at the top, the other one attached from the bottom. These are what we call the vena cava. So we have the superior vena cava, we have the inferior vena cava. The superior vena cava is going to bring deoxygenated blood from the neck and the head region and send the blood into the right atrium. The inferior vena cava is going to bring deoxygenated blood from the rest of the body and send it into the right atrium. So the right atrium receives all the deoxygenated blood in our body. All of that blood that has been used up, all the oxygen has been used, is going to arrive at the right atrium of the heart. From the right atrium, the blood is going to enter another chamber called the right ventricle. And then from the right ventricle, now the blood is going to enter what we call the pulmonary trunk. Where is the pulmonary trunk? Everybody look up here, please. The pulmonary trunk, guys, is this region that I just highlighted for you. Okay? And this pulmonary trunk will split into two branches, one going towards the right side, the other one going towards the left side. These blood vessels are what we call the pulmonary arteries. So we have the left pulmonary artery and we have the right pulmonary arteries. What are they going to do, folks? The pulmonary arteries are going to take that deoxygenated blood and send it to our lungs. The left pulmonary artery is going to send to the left lung. The right pulmonary artery is going to send it to the right lung. Now, what's going to happen to the blood once it gets into the lungs? Now it's going to become oxygenated once again. And now this oxygenated blood needs to return to the heart. And it's going to return to the heart through what we call the pulmonary veins. And we have two different sets. We have the right pulmonary veins and we have the left pulmonary veins. Guys, tell me again, what is the difference between an artery and a vein? What is an artery? How does it differ from a vein? Does anybody remember? We talked about this before.
The artery is the arterial major blood vessel that transfers the blood and oxygen around the heart. Whereas the vein, it branches out in smaller vessels, blood vessels.
No, that's not the correct definition. We have a simpler definition that applies always. And there we go. Arteries bring blood to the body. Okay, so a better way to say is arteries take blood away from the heart. Veins bring blood back to the heart. Write this down, folks, so you don't forget. I already talked about this many times before. So once again, what is the definition? What is the difference between an artery and a vein? Arteries take blood away from the heart. Veins bring blood back to the heart. So we call these little guys here pulmonary arteries because they're taking blood away from the heart towards the lungs. We call these ones here the pulmonary veins because they're bringing blood back into the heart. Okay, so the left atrium of the heart will receive all the oxygenated blood coming from the lungs. From the left atrium, now the blood is going to enter the left ventricle. And now from the left ventricle, the blood is going to enter different sections of the aorta. We have the ascending aorta, we have the aortic arc, and we have the descending aorta. So guys, in an exam like the one coming up next week, Tuesday, if I am pointing to a section of the aorta, it is not enough just to say aorta. You need to tell me if I'm pointing to the ascending aorta, in which the blood is moving up, the aortic arc, this band right here, or the descending aorta. Okay? Any questions, folks? All right, so we just looked at the four chambers of the heart and we look at the great vessels of the heart. Now, let's talk a little bit about the circulation of blood through our body. Folks, there are several different types of blood circulation. We have what we call systemic circulation, we have pulmonary circulation, we have coronary circulation, we have hepatic circulation, we have a fetal circulation, we have cranial circulation. There are many different circulations of blood. The main circulation of blood, which is between the heart and the rest of the body, this is what we call systemic circulation. So what is the systemic circulation? The circulation of blood between the heart and the body. Now, we also have a circulation of blood between the heart and the lungs. This is what we call the pulmonary circulation. Okay, now if you look here at the arteries and veins of the systemic and the pulmonary circulation, they are labeled in different colors. Why? Well, that is because the arteries in the systemic circulation, they are carrying oxygen-rich blood, and therefore they are labeled in red. While the veins of the systemic circulation, they are labeled in blue because they're carrying oxygen-poor blood. Now, if you look at the pulmonary circulation, it is the opposite. The arteries are blue and the veins are red. That is because the arteries in the pulmonary circulation are carrying oxygen-poor blood, which is going to the lungs to become oxygenated, while the veins are labeled red because they are carrying oxygen-rich blood back to the heart. Okay? This is why we should never say that arteries carry oxygenated blood and veins carry deoxygenated blood, because it doesn't always apply. Yes, it applies for the systemic circulation. It does not apply for the pulmonary circulation. Okay? Now, let's talk about what we call the coronary circulation. What is the coronary circulation? The coronary circulation is a circulation of blood through the heart walls. So it's going to bring in oxygenated blood filled with nutrients, and also is going to remove the CO2 and the waste from the heart tissue. And there are 6 coronary arteries and 3 coronary veins you need to know for the exam. Let's go over the coronary arteries first. Okay? First of all, before we move any further, let's split the heart into 2 halves. How do we do that? We're going to pass an imaginary line from the base of the heart, going through the interventricular wall, and then exiting to the apex. So there we have right side of the heart, left side of the heart. So now we can name those coronary arteries. We can see right here, folks, everybody look up for a second, please. We can see right here, there is a blood vessel that is literally siphoning oxygenated blood on the right side of the ascending aorta. And right over here, there is another blood vessel that is siphoning oxygenated blood on the left side of the aorta. So the one on the right side is called the right coronary. The one on the left side is called the left coronary. Now, if you follow the right coronary all the way up to this point right here, we can see how the right coronary splits into 2 branches. One coming towards the front of the heart. This is what we call the marginal branch. The other one going towards the back of the heart. This is what we call the posterior interventricular branch. Okay? Right here. Now, what about the left coronary? Let's follow the left coronary. The left coronary is going to come all the way to this point right here. And now it's going to split into 2 branches again. One coming in the front. The one in the front is what we call the anterior interventricular branch. And the one going towards the back side, this is what we call the circumflex branch. So let's recap. The right coronary splits into marginal branch in the front, posterior interventricular in the back. The left coronary splits into anterior interventricular in the front and circumflex branch in the back. Okay? And these are the 6 coronary arteries you need to know. Now, what if someone has a blockage of one coronary arteries? Let's say that someone has a embolus right here, which is blocking the flow of blood to this region of the heart. What happens now, guys? This individual has what we call a myocardial infarction, aka a heart attack. So a heart attack is when there is blockage to any of the coronary arteries, which is going to interrupt the flow of blood to the cardiac wall. Okay? And that tissue, the cardiac tissue, is going to die if it doesn't receive any blood supply. Now, what about the coronary veins? Well, there are 3 coronary veins you guys need to know for the exam. There's a major one right in the front, right here, folks, running right next to the anterior interventricular artery. This vein is what we call the great cardiac vein. So in the front of the heart. Then this great cardiac vein is going to go towards the back of the heart and become what we call the coronary sinus. We can see the coronary sinus here in the back of the heart. And then the coronary sinus is going to split and go towards the apex of the heart and the backside. And this is what we call the middle cardiac vein. Okay, so once again, we have the great cardiac vein, we have the coronary sinus, and we have the middle cardiac vein. Any questions, guys? All right. So let's see here. Let's talk about, watch a little video about a treatment for when someone has a myocardial infarction. And this treatment is something called an angioplasty. Now, an angioplasty is a treatment when you can crush, you can remove whatever is blocking that coronary artery. If you cannot remove the block, then that patient is going to need what is called a coronary artery bypass. And a coronary artery bypass is an open heart surgery, okay? Is a much bigger procedure than an angioplasty. So let's take a look at this here.
What 2 fruits can help ripen an avocado quickly? Is it an orange and a lime, a peach and a strawberry, or C, an apple or banana?
Apple and banana.
That's correct.
Myocardial infarction, commonly referred to as heart attack, is the sudden death of part of the heart muscle due to loss of blood flow. This occurs when one of the coronary arteries, the arteries that supply blood to the heart, is blocked. The blockage is commonly due to atherosclerosis, cholesterol plaques or fat deposits on the wall of blood vessels. As the plaque builds up, the vessel becomes narrow, restricting blood flow. Under stress, the plaque may rupture. This triggers formation of blood clot on top of the plaque, leading to complete blockage of blood flow. When this happens in the coronary artery, the downstream patch of the myocardium dies from lack of oxygen. Weakened heart muscle may disrupt electrical activity of the heart and subsequently cause cardiac arrest. Coronary angioplasty is a non-surgical procedure used to open narrowed or blocked coronary arteries. It can also be performed as an emergency treatment for myocardial infarction. The first part of the procedure is to localize the site of blockage. This part is called cardiac catheterization. A guiding catheter is inserted through the femoral artery at the groin and threaded all the way to the aorta. The tip of the catheter is placed at the beginning of the coronary artery to be investigated. A radio-opaque dye is injected through the catheter into the coronary artery. This enables real-time visualization of the artery using X-ray imaging. A narrowed part of an artery would appear as a bottleneck on an X-ray image. After the location of narrowed artery is identified, angioplasty can begin. A guide wire with a deflated balloon is inserted and pushed to the location of blockage. The balloon is inflated to crush the plaque. At the end of the procedure, the balloon is again deflated and removed together with all catheters and guide wire. In some cases, a stent is inserted together with the balloon, inflated, and left in place of the plaque to keep the artery open permanently.
All right, guys, any questions? All right, moving on. Go ahead, Larissa.
Is it okay to leave some material like that in the blood vessel?
Yes, it is.
Oh, okay.
Yeah. Mhm. And I mean, this is very common actually. And if you ever hear people that have stents, so that's what a stent is. Sometimes people might have a 2, 3, 4 stents placed, at the same time because they have several coronary arteries that are blocked. Okay. All right, so let's take a look now at the heart valves. And just like the heart chambers, we also have 4 different heart valves. Folks, you need to know this for the exam. Okay, it will be on the exam. Now we have a 2 AV valves or atrioventricular valves, and we have a 2 SL valves or semilunar valves. Before we name the AV valves, once again, let's split the heart into 2 halves. Let's pass that imaginary line from the base, going through the interventricular wall and exiting through the apex, right? So we have left side, we have right side. So now we can name the AV valves. On the right side, we have the right AV between the right atrium and the right ventricle. On the left side, we have the left AV between the left atrium and the left ventricle. Now, notice here, however, guys, that the right AV is also called tricuspid, while the left AV is also called bicuspid or mitral. Folks, in the exam, pick one name and one name only. It is not the right AV tricuspid valve. It is not the left AV bicuspid mitral valve. Pick one name. Okay? Another thing that I want to mention here is that it is not the right tricuspid. It is the right AV, but we don't have a right tricuspid because when you say right tricuspid, you imply there's a left tricuspid. There is no left tricuspid. The same thing with the bicuspid. There is no left bicuspid. There is no left mitral. There is a left AV, bicuspid or mitral. Okay? Now, the AV valves, the atrioventricular valves, they have little strings, and we can see those little strings right here that is going to anchor the valve to the inner walls of the chambers. These little strings are called the chordae tendineae, and they are bilateral. If I'm pointing to these strings right here, this would be the left chordae tendineae. If I'm pointing to these ones right here, this would be the right chordae tendineae. Now, the chordae tendineae, they help with the opening and closing of the AV valves, and they are anchored inside of the chambers by tiny little muscles called the papillary muscles. And once again, these papillary muscles are also bilateral. We have the left papillary muscles, we have the right papillary muscles. Okay? Now let's move on to the semilunar valves. And the semilunar valves, they are not right and left. We have what we call the pulmonary SL valve, and we have the aortic SL valve. What is the difference between the pulmonary and the SL? Guys, everybody look up here. The pulmonary SL, which is shown here in blue, it is separating the right ventricle from the pulmonary trunk, hence the name pulmonary SL. Now, the aortic SL is separating the left ventricle from the ascending aorta, hence the name aortic SL. Okay, I highlighted the pulmonary in blue and the aortic in red. I have a question here. So if we write right AV valve or left AV valve, we should be fine. Absolutely. Absolutely. I would just stay away from all the other names. Just say right AV and left AV, to keep it simple. Okay, Janelle? Any other questions, guys? All right. You're welcome. Now, let's take a closer look how those valves work. So let's start with the AV valves first and understand what's happening here. How do they open and close? Okay? Guys, when the blood arrives in the atria, both right and left atrium, the atria, and by the way, all the blood is going to arrive at the same time in both of the atria. The atria will increase its pressure because of the volume of blood entering the atria. The pressure inside of the atria will go up. When the pressure of the atria goes up and is greater than the pressure inside of the ventricles, that is going to push open the AV valves. So now, because of all the pressure in the atria, the AV valves are going to open and is going to allow the passage of blood from the atria into the ventricles. So now, as the blood enters the ventricles, the ventricular pressure is going to increase, right? Because we have now all this blood going into the ventricles. And when the ventricular pressure is greater than the atrial pressure, now the AV valves are going to close. Okay, which is going to prevent the blood from going backwards into the atria. Now, what about the SL valves? The SL valves is similar. When the pressure inside of the ventricles increase, that is going to push open the SL valves, both of them, pulmonary and aortic. When the pressure inside of the ventricles goes down, that is going to cause the closing of the SL valves. Okay, again, preventing the blood from going backwards. Would the pressure on the valves be different if you were in space? Yes, it could be different. It was not going to be exactly the same as if you are on Earth, but independent, there would still be greater pressure when the blood fills the atria. There would be a greater pressure inside of the atria than the ventricles. And when the blood fills the ventricles, that would increase the pressure in the ventricles. So that wouldn't change. The specific pressure might be different, in Earth or in space, depending if you have gravity or not, but the overall result would be the same. Okay. Now, what happens if a valve is not working properly? Guys, this is going to lead to a condition called heart murmur. What is a heart murmur? A heart murmur is when we have an incompetent valve, and it could be any of the valves. It could be the right AV, left AV, pulmonary, aortic, which is not closing all the way. And when they don't close all the way, they're going to allow the backflow of blood. So all of you have been to a doctor before, right? At the beginning of the consultation with your doctor, the doctor is going to take the stethoscope and put it into his ear or her ears, and then he's going to take the diaphragm of the stethoscope and he's going to move it around your chest. Do you know what the doctor is listening to? The doctor is listening to the opening and closing of the valves, and to make sure there is no backflow of blood, because you can hear the regurgitation, we can hear the backflow of blood if the valves are incompetent. Okay? Now, there is some people in which they have a heart murmur, but the backflow is very minimal. Doesn't really affect their daily lives. But for other folks, that heart murmur is more severe, meaning that the valves are more incompetent, and therefore they're going to need to have open heart surgery to correct the valve or to replace the valve with either a valve from a pig or a synthetic valve, okay, an artificial valve. Any questions, guys? All right. All right, moving on. So, guys, we are done with the anatomy of the heart. Let's move on now and talk about the physiology. And we all know that our heart can beat on its own. We don't control our heart beating, which is great, so that we can go to bed at night and sleep and not worry about contracting our cardiac muscles. That would be horrible. Okay? So our heart has an autonomic control. Now, what allows the heart to beat on its own? Guys, we have inside of our heart a group of little cells, very special cells, called natural pacemaker cells. What is so special about these natural pacemaker cells? These natural pacemaker cells, they can generate their own action potential. They can generate electricity. They can create electrical impulse on their own. They don't need any information from the brain. They just keep on sending action potential. Now, these natural pacemaker cells, they are clustered inside of our heart into two little nodes in the right atrium. The main node is what we call the sinoatrial node, or the SA node. The other node is what we call the atrioventricular node, or the AV node. Everybody look up for a second, please. Can you see how there are arrows coming off from the SA node? These arrows are representing action potential. They are representing electrical impulse. And we can see how this electrical impulse is spreading from the right atrium into the left atrium, and also downwards towards the junction between the right atrium and the right ventricle. So when the action potential gets right here to the AV node, now this AV node is going to receive that stimulus and is going to pass that stimulus along a bundle of nerve inside the ventricular walls. The first section of the nerve inside the ventricular wall right here, this is what I call the bundle of His. Then this bundle of His will split into two branches. So we have the left branch, we have the right branch, and these are called the bundle branches. And finally, the bundle branches are going to go all the way down to the apex, and they are going to move upwards into the external ventricular walls and become what we call the Purkinje fibers. These are nerves inside the ventricular wall. And those nerves, they're going to spread that action potential. And as the action potential spreads through the ventricular wall, what's going to happen, guys? We're going to have the contraction of the heart. Okay? And that contraction happens in a very coordinated manner. It's going to start at the atria. The atria will contract first, pushing the blood into the ventricles. Then the ventricles will contract, pushing the blood out of the heart. So we have contraction of the atria, then contraction of the ventricles. Okay? So let's see what happens with the heart in a single heartbeat, which is about 0.8 seconds. It's quite fast. And when we look at the single heartbeat, we are going to look at our cardiac cycle. And the way to measure our cardiac cycle is by doing a test called an ECG, also called an EKG. And an ECG or a EKG stands for what? An electrocardiogram. So what is an electrocardiogram? An electrocardiogram is a test that is done to check the electrical impulses running through the heart. That's what we're going to measure. Okay? And what we're looking at here on the screen, this little graph, guys, this is the result of an electrocardiogram. And we are going to analyze the result of the electrocardiogram right now. Again, keeping in mind that we're looking at a single heartbeat, one heartbeat, okay? And in a single heartbeat, we can see these different waves right here. There's one here. There's another big wave right here. And then another third wave right here. The first wave is what we call the P wave. The second wave is what we call the R wave, which is part of a complex called the QRS complex. And the third wave is what we call the T wave. So let's understand what each one of those waves represents in terms of the electrical impulse in our heart. Okay, let's start with the P wave first. The P wave represents atrial depolarization. By the way, this is going to be on our next exam. If you don't understand, now is a good time to speak up. All right? So what is the atrial depolarization? First of all, let's understand what depolarization is in general. I have talked about depolarization before when we discussed about the skeletal muscle and about the neuron. What is a depolarization, guys? Write this down. Depolarization is when the sodium channels of the cardiac cells are going to open, allowing sodium to enter the cell. When the sodium enters the cell, it changes inside of the cell from negative to positive and outside from positive to negative, creating what, guys? Creating an action potential. So let me repeat that. Depolarization is the opening of the sodium channel in the cardiac cells, which leads to the generation of an action potential. And after the action potential, what's going to happen to the cardiac muscle cell? The cardiac muscle cell is going to contract. So after depolarization, there is contraction. So here we have the depolarization of all the atrial cells, which means that immediately after, there will be contraction of the atria. Okay? Next, we have the R wave, and the R wave represents ventricular depolarization. So now, instead of the cells of the atria depolarizing, we're going to have the cells of the ventricles depolarizing. And again, what's going to happen immediately after ventricular depolarization, guys? We're going to have ventricular contraction. So now the ventricles contract and squeeze the blood out. And finally, we have the T wave, and the T wave represents ventricular repolarization. First of all, what is repolarization? Repolarization is the opposite of depolarization. In repolarization, the sodium channels are going to close, the potassium channels in the cells are going to open, and potassium is going to go outside of the cell, bringing the cell back to the resting membrane potential. So the cell, again, is going to be at rest. So what happens immediately after repolarization? We're going to have a relaxation. So let's repeat that. We have a depolarization, contraction, repolarization, relaxation. Depolarization, contraction, repolarization, relaxation. Okay? Any questions, guys?
What does the Q and S stand for? Because I know it's like the PRT, but what about the Q and the S?
Yeah, so that just represents different sections of actual the ventricular wall, different parts of the ventricles that are going to depolarize. And we're going to watch a little video in a second that's going to show exactly what the Q and the S means. Okay? Any other questions? I have a question for you. There's a question you guys should have asked me. If you look at the screen right now, you should notice that there's something missing. What is missing, guys? Look at this, okay, right here, and tell me what is missing. Let's play the game. It's right on your face.
Q.
No. What is missing? We have atrial depolarization, we have ventricular depolarization, we have ventricular repolarization. What is missing, guys?
The atrial repolarization.
Atrial repolarization, absolutely. Absolutely. Not repolarization. Now, what happens? Where is the atrial repolarization signal? Well, we don't see the signal because the signal happens at the same time as the QRS complex. And because the QRS complex is a stronger signal, it hides the signal for atrial repolarization. But it happens. Otherwise, the atria could not relax. If there is no repolarization, there is no relaxation. And our atria needs to relax in order to refill with blood. Okay? So
The QRT complex.
there's no QRT. And now let's take a look at this video right here. And this video is going to walk us through in a little bit more detail about what's happening during an ECG and the cardiac cycle. Okay.
The cardiac conduction system consists of the following components: the sinoatrial node, or SA node, located in the right atrium near the entrance of the superior vena cava. This is the natural pacemaker of the heart. It initiates all heartbeat and determines heart rate. Electrical impulses from the SA node spread throughout both atria and stimulate them to contract. The atrioventricular node, or AV node, located on the other side of the right atrium, near the AV valve. The AV node serves as electrical gateway to the ventricles. It delays the passage of electrical impulses to the ventricles. This delay is to ensure that the atria have ejected all the blood into the ventricles before the ventricles contract. The AV node receives signals from the SA node and passes them onto the atrioventricular bundle, AV bundle, or bundle of His. This bundle is then divided into right and left bundle branches, which conduct the impulses toward the apex of the heart. The signals are then passed onto Purkinje fibers, turning upward and spreading throughout the ventricular myocardium. Electrical activities of the heart can be recorded in the form of electrocardiogram, ECG, or EKG. An ECG is a composite recording of all the action potentials produced by the nodes and the cells of the myocardium. Each wave or segment of the ECG corresponds to a certain event of the cardiac electrical cycle. When the atria are full of blood, the SA node fires, electrical signals spread throughout the atria and cause them to depolarize. This is represented by the P wave on the ECG. Atrial contraction, or atrial systole, starts about 100 milliseconds after the P wave begins. The PQ segment represents the time the signals travel from the SA node to the AV node. The QRS complex marks the firing of the AV node and represents ventricular depolarization. Q wave corresponds to depolarization of the interventricular septum. R wave is produced by depolarization of the main mass of the ventricles. S wave represents the last phase of ventricular depolarization at the base of the heart. Atrial repolarization also occurs during this time, but the signal is obscured by the large QRS complex. The ST segment reflects the plateau in the myocardial action potential. This is when the ventricles contract and pump blood. The T wave represents ventricular repolarization immediately before ventricular relaxation, or ventricular diastole. The cycle repeats itself with every heartbeat.
All right, guys, any questions?
Like a swimming pool slide.
You could say that. All right, moving on. So we just look at what a normal ECG, a normal cardiac cycle looks like. Why does the AV node delay? The AV node delays in order to make sure that we have all the blood coming from the atria has entered into the ventricles. If we did not have that AV, the ventricles would start contracting before all the blood has been moved into the ventricles. By delaying it, it makes sure that the ventricles are filled with blood. Okay. So we just looked at a single heartbeat right here, and we talked about the little P wave, the QRS complex, the T wave. Now, sometimes the electrical impulse that is running through an individual's heart might not be working properly. And this condition is what we call the cardiac arrhythmias. And there are several different types of cardiac arrhythmias for several different reasons. Okay? We could have a ventricular tachycardia, atrial tachycardia, ventricular bradycardia, atrial bradycardia, ventricular fibrillation, etc. Now, let me show you two of the most important and the most common and the most lethal of the cardiac arrhythmia. One is called the ventricular tachycardia. And ventricular tachycardia is when our heart is, our ventricle specifically, is contracting and beating very fast. And now, I'm not talking about us exercising. It's normal for us, our heart to go into tachycardia after we exercise, right? Because now our heart rate is going to go up in order to supply more blood with oxygen and nutrients to the body. Now, in a ventricular tachycardia is when that individual is at rest, and yet the heart is beating very fast. Okay? This here can lead to a cardiac arrest because the ventricles cannot keep up with pumping and keep on contracting. The other very serious arrhythmias is what we call ventricular fibrillation, also called the VFib. You might have heard of VFib before. What is a ventricular fibrillation? Ventricular fibrillation is when we have a disordered electrical signal running through the cardiac walls. Guys, if you look at the normal heartbeat right here, remember we talked about the signal starting all the way here and the SA node, and then it's spreading through the left atrium, spreading towards the AV node, and then from the AV node is going to go through the bundle of His, bundle branches, Purkinje fibers, and that is going to allow the contraction in a very coordinated manner of our heart, starting at the atria, then finishing at the ventricles. Someone that has ventricular fibrillation, look at this, guys. We have this firing of electrical impulse all over the ventricular wall. It's not a coordinated flow of the action potential. It's firing in several places at the same time. Now, do you think the ventricles are going to be able to contract? No. The ventricles, they're going to flutter, and that is going to lead again to cardiac arrest. Okay? What is an emergency treatment for ventricular fibrillation? A device called an AED, or a automated external defibrillator. And in an AED, what it's going to do is that if someone has a ventricular fibrillation, they're going to put some pads over the chest, and then they're going to turn on the machine, and they're going to literally shock the heart of that individual. Now, what is shocking going to do? Shocking the heart will stop all of those signals. It will literally stop the heart. Now, wait a second. Why are we stopping the heart? Well, we're stopping the heart to stop all of that signal, that disorganized signal. And then after we shock the heart, you're going to do CPR. You're going to massage the heart, cross your fingers, and pray to whatever God you pray to, that the heart again is going to start beating on its own. Okay? But the job of the AD is just to shock and stop all the disorder electrical signal. Any questions, guys?
Arrhythmic.
All right, moving on. Let's talk about the heart sounds now. And first of all, what causes our heart sound? We know that we have a very peculiar heart sound. It's what we call the lub-dub sound. And the lub sound, guys, also called the S1, is due to the closing of the AV valves, both of them right and left at the same time. While the dub sound, also called the S2 sound, is caused by the closing of the SL valves, both of them, pulmonary and aortic, at the same time. So this is what our heart sounds like. It goes like this, guys. Okay, and that is due to the closing of the valves after the blood passes right through them. And finally, let's take a look at the cardiac output. What is cardiac output? The cardiac output is how much blood can be pumped out of the heart in a minute. And the cardiac output is going to depend on two different variables. It's going to depend on our heart rate, and it's going to depend on the stroke volume. Now, of course, if our heart is beating faster, we're going to pump more blood out of the body, out of the heart, and that is going to increase cardiac output. If the heart rate is slow, our cardiac output is going to decrease. Now, what about stroke volume, guys? Folks, stroke volume is the amount of blood that your left ventricle can hold. So once again, stroke volume is the amount of blood that your left ventricle can hold. If you have a big left ventricle, your stroke volume is higher, your cardiac output is higher. If you have a small left ventricle, that means your stroke volume is lower and your cardiac output is going to be lower as well. Now, let me tell you something that can affect our stroke volume, and that is hypertension. Okay, high blood pressure. Why? How does hypertension affect the stroke volume? Guys, hypertension causes our heart to work harder. It needs to work harder in order to pump the blood and go against the increased pressure in the arteries. Now, just like any muscle, any cardiac muscle, any skeletal muscle in our body, if we want to increase the muscle volume, we need to work out, right? Against resistance. So the more we work our heart, the harder our heart works to pump the blood, the thicker the walls of the left ventricle will be. Now look at this. Imagine that this is your left ventricle right here, and this is the wall of your left ventricle. All right, right here. Now, if you have hypertension and your heart is working very hard, what's going to happen is that the walls of the left ventricle are going to become thicker. Folks, look what happened with the space itself. The space decreased, which means what? Which means that you can pump less blood. Your stroke volume is going to go down. Okay? And your cardiac output is going to go down. So people that have hypertension, they have a lower cardiac output. Okay? Now, what can affect our cardiac output? Anything that affects our heart rate, anything that affects our stroke volume will affect the cardiac output as well. Any questions? All right. Now, as I mentioned earlier today, we all know our heart beat on its own. Our heart has an autonomic control. It does not need us to think about contracting our cardiac muscles. Now, nevertheless, there is in our brain a cardiovascular center right at the medulla oblongata, and there are sensors spread throughout our body that will send signal to the cardiovascular center that then will relay the signal all the way to the SA and the AV node in the heart. Guys, what happens if right now we all get up and we start to move around and exercise? What's going to happen to our heart rate? It's going to go up. How does it happen? Look, we have little receptors embedded in our skeletal muscle called proprioceptors. And these proprioceptors, they can perceive movement. The more movement we do, the greater the signal, and the proprioceptors, they're going to be connected all the way to the cardiovascular center. And then the cardiovascular center is going to send an action potential, a signal, through what we call the cardiac accelerated nerves, which innervates the SA node, innervates the AV node, telling the SA and the AV node to increase the depolarization and produce more action potential. That is going to increase our heart rate. Okay? Now, we also have signals that is going to tell the cardiovascular center to slow down our heart. And then the cardiovascular center is going to send signal to a different group of nerve called the vagus nerve, and the vagus nerve will decrease the rate of spontaneous depolarization of the SA and AV node. Meaning what? Meaning that our heart rate is going to go down. Okay? Yes, we don't control it, our heart rate, but there are things that happen to our body that will affect our heart rate. It is going to increase or decrease the heart rate. The cardiac accelerated nerves are involved with our fight or flight response, while the vagus nerve is involved with our rest and digest response. Now, let's discuss a very serious heart disease, and that is atherosclerosis. What is atherosclerosis? Atherosclerosis is the formation of atherosclerotic plaques inside our coronary arteries. Folks, we are looking right here at a cross-section of a coronary artery of a healthy individual and an individual that has atherosclerosis. On the left-hand side, we can see this nice, normal, healthy blood vessel right here. Okay? On the right-hand side, we can see this blood vessel that has a huge atherosclerotic plaque. This entire stuff right here, this is the atherosclerotic plaque that it starts to form inside the coronary artery of this individual. Folks, what can happen eventually? Eventually, this plaque here could completely block the passage of blood through that coronary artery. And if this happens, what's going to happen to that individual? That individual will have a myocardial infarction. They're going to have a heart attack. Okay? Now, what forms the atherosclerotic plaques? What forms them is an elevated level of cholesterol, specifically low density lipoprotein, what we call the LDL cholesterol. Because LDL, low density lipoproteins, their job is to take fat and deposit it into our organs and tissues. So when you have high levels of low density lipoprotein, that can lead to the formation of atherosclerotic plaque, and then calcium is going to be deposited into the plaques, making the plaques hard. They look like bone, bony tissue. And when they are there, when they harden, they become permanent. Okay, you can't remove them unless you do a surgical procedure, which is the angioplasty, or if angioplasty cannot fix it, you're going to have a coronary artery bypass. Okay? Any questions, guys? All right. All right, folks, we are done with the heart. The only thing left to do now for this chapter is talk about the blood vessels. We have 5 different blood vessels. You need to know this for the exam. What are they? We have the arteries, arterioles, capillaries, venues, and veins. We know the job of an artery. Artery takes blood away from the heart. Okay? After the blood passes through the artery, now the blood is going to enter the arterioles. The arterioles, they are very important to help to maintain our blood pressure. And then after the arterioles, now the blood is going to enter the capillaries. Where do we find capillaries, guys? We find capillaries embedded in all the organs and tissues in our body, because the capillaries are the ones supplying the blood to the cells and the tissues. In the capillaries, this is where we're going to find the exchange of gases, nutrients, and waste between the blood vessel and the tissue. Okay? Oxygen gas and CO and the nutrients is going to go into the tissue. CO2 and waste is going to go out of the tissue into the capillary. From the capillary, now the blood is going to pass through the venules, and then from the venules, the blood is going to enter the vein. What is the function of the vein? Veins bring blood back to the heart. Where is all that the oxygenated blood is going to arrive, guys? It's going to arrive in the right atrium of the heart. Okay? Now, 4 blood vessels out of the 5, they have 3 different layers that make up the walls of the blood vessels. They have an inner layer called the tunica intima, a middle layer called tunica media, and an outer layer called tunica externa. So the arteries, the arterioles, the venules, and the veins, they all have these 3 layers. What is the exception here? The exception are the capillaries. Capillaries only have one single layer. What is that layer? They only have the tunica intima. They don't have a tunica media or tunica externa. Why not? Well, we want to make sure that we have the ability for the gases and nutrients and waste to pass through the wall of the capillary. If you have three layers, that makes it more difficult for that exchange to happen. If you have one single layer, it makes it easier for the exchange of gas, nutrients, and waste. Okay? So let's take a look at an artery and a vein. And guys, I want you to know two differences between an artery and a vein, which we're going to discuss together right now. Okay? You need to know this for the exam. So what are two differences between an artery and a vein? First of all, first difference, everybody look up here, please. Can you see this section, this layer right here that I'm circling for you? This is a layer of smooth muscle in the walls of an artery. Now take a look at the same smooth muscle in the walls of the vein. Can anybody tell me which one is thicker? Which one has a thicker layer of smooth muscle, the artery or the vein?
The vein.
Does it, Larissa? Look at the screen here. I just
The
highlighted
artery.
the arteries, the arteries.
Ah,
Look over here, guys. Look, this is the thickness of the smooth muscle. I just highlighted them for you. This is the thickness of the smooth muscle of an artery. This is the thickness of the smooth muscle of a vein. It's right there on the screen. So arteries have a thicker layer of smooth muscle than the veins. Now, what is the second difference? Veins have valves right here, which we do not find them in the arteries. Okay?
blue.
So veins have, no, it's not a difference being blue. That's not a difference. Arteries have a thicker layer of smooth muscle and they don't have valves. Veins have a thinner layer of smooth muscle and they do have valves. What is the function of the valves, guys? The valves are going to prevent the blood backflow. So as the blood is going through the veins, right, and coming back to the heart, the valves are going to make sure that the blood keeps moving upwards, not down. Now, what happens if the valves of the veins are not working properly? This is what happened. That individual is going to develop what is called a varicose vein. Look at this, guys. Can you see all these veins popping out from the skin right here? This is an indication of a varicose vein. Now, what is a varicose vein? A varicose vein is when we have an incompetent valve in which the valve does not close all the way. Now, not only a varicose vein doesn't look very nice, is not very aesthetically pleasing, but that is the least of the problem of a varicose vein. The real problem of a varicose vein is that, guys, when the blood pulls, when the blood goes backwards and it pulls in one place, what is going to happen? We are going to have the development of a clot. Clots can form when the blood pools. Now, what happens if this blood goes to our brain? It's going to develop an embolic stroke. What happens if the blood clot goes to our lungs in the small capillary? It's going to develop pulmonary embolism. Both an embolic stroke and a pulmonary embolism are lethal. That can kill an individual. Okay? Are those the same things as spider vein? No, they are different, Vanessa. Spider veins is when we have a rupture of a small capillaries and then you're going to see they kind of look like a spider web. Okay. But a varicose vein is when we have an incompetent valve in a vein, and that's going to, the blood is going to pool in one place. But the spider veins is just a disruption, a disturbance of the little capillaries under the skin. All right, guys, let's name some blood vessels now. You're welcome. And we're going to start with some arteries of the head and the trunk and the upper limb. So you guys do need to know these arteries that we're going to be discussing right now. Okay, all of those that I will go through with you in class in the PowerPoints, you are responsible for them. So let's start here with some of the blood vessels, some of the arteries of the upper trunk. And I want you guys to focus right now on the arc of the aorta, right here, folks. If you look at the arc of the aorta, you're going to notice that there are three different blood vessels that are literally branching off the arc of the aorta. We have one blood vessel right here, another blood vessel right here, and a third one right there. What are these blood vessels? The first one is what we call the brachiocephalic trunk. Now, I wanted to notice here, however, that the brachiocephalic trunk is just this little section right here. Because then the brachiocephalic trunk is going to branch into the right common carotid and the right subclavian. Okay? What about the number two? The number two is what I call the left common carotid, which is going to supply blood to the left side of the head. So the right common carotid is going to supply blood to the right side and the left to the left side. And then the number three is what we call the left subclavian, which is going to supply blood to our left arm. Okay? On the other side, we have the right subclavian, and the right subclavian, as it passes under our armpit, is going to become the axillary. So we have the right and left axillary. And as it passes through our upper arm, is going to become what we call the brachial. We have the right and left brachial. And then the brachial, when it goes into our forearm, is going to split into two major branches. One running next to the ulna, the other one running next to the radius. And those are what we call the right and left radial the radial artery and the ulnar artery. Okay? So keeping in mind, we have the same distribution on the left arm as well. All right? Moving on, let's talk now about the blood vessels, the arteries of the abdominal pelvic cavity. First of all, guys, everybody look up here for a second, please. Remember that we have this big, thick muscle called the diaphragm separating the thoracic cavity from the abdominal cavity, right? Now, we also looked at the aorta and how the aorta is divided into different sections. We have the ascending aorta, aortic arc, and then the descending aorta. So guess what? The descending aorta is also called thoracic aorta because it's passing through the thoracic cavity. Now, as soon as the thoracic aorta goes through the diaphragm, there's literally a hole in the diaphragm to allow the thoracic aorta to pass through it. Now, the thoracic aorta is going to become the abdominal aorta right here. And this abdominal aorta is going to branch off into smaller arteries that is going to supply blood to different organs in our abdominal pelvic cavity. The abdominal aorta is going to become what we call the celiac trunk right here. And the celiac trunk will supply blood to the stomach, the spleen, and the liver. Then the abdominal aorta is going to branch off into the superior and inferior mesenteric artery. The superior mesenteric is going to supply blood to the small intestine and part of the large intestine. And the inferior is going to supply blood to the rest of the large intestine. And then we have the renal artery and the gonadal artery. The renal artery is going to supply blood to our kidneys, and the gonadal artery is going to supply blood to our gonads, which are our testes and our ovaries. Okay? Now, moving on to the lower limb, and you guys also need to know all of these for the exam. Everybody look up here, please. If you follow the abdominal aorta all the way up down here at the top of the hip bones, we can see that it's going to split into two branches, one going towards the right, the other one going towards the left. These are what we call the common iliac artery. So we have the right common iliac artery, we have the left common iliac artery. The common iliac artery now is going to split once again. There's going to be a small blood vessel right here. It's going to pass through the obturator foramen of the hip, and it's going to stop. And there's a bigger branch, which is going to continue over the hip, going towards the leg. The one going outside of the hip, which is going to become eventually the femoral artery, is called the external iliac artery. The one passing through the obturator foramen of the hip is called the internal iliac artery, which is going to end. It's not going to go any further. Okay? Now, the external iliac, as it goes down into our upper leg, is going to become the femoral artery. And then the femoral artery is going to pass behind the knee, becoming the popliteal artery. And then the popliteal artery is going to run next to the tibia, two different blood vessels, one in the front of the tibia, the one in the back. And these are what we call the anterior and posterior tibial artery. And finally, the anterior tibial artery is going to branch off into what we call the dorsalis pedis artery. And this one is going to supply blood to our feet. Okay? And keeping in mind that all of these blood vessels are bilateral. Now we are done with the arteries. What about the veins? Don't freak out. You don't need to know the name of all these veins, with the exception of two. Which two? You need to know the hepatic vein and the hepatic portal vein. And we are going to talk about them in a minute. Okay? So let's take a look now at what we call the special or portal circulation. And three of the most important special circulation are what we call the cerebral, the hepatic, and the fetal. What is cerebral, guys, in relation to what? Our brain. How about hepatic? Our liver. How about fetal? In regards to the fetus. Okay, so let's take a look at each one of the special portal circulation, starting with the cerebral portal circulation. Folks, there is only one blood vessel that you need to know from the cerebral circulation, and that is a blood vessel called the circle of Willis, also called the cerebral arterial circle, and it's right at the base of the brain. So I want you guys, everybody, to look up here for a second, please. Why do you think we have this round, this circular artery right here at the base of the brain? What do you think is the purpose of having this circular shaped artery? Let's see here. Going around the spinal cord. That's a good guess, but no, that's not the function, the reason why.
To to connect the blood vessels pericardially, like a
No.
bridge. Oh,
A bridge. Um, not really a bridge. I have another keep all the arteries of the brain in the loop. That's a good way to put it. Guys, let's put it this way, okay? Everybody look up here. Can you imagine? Let me erase this here for a second. Can you imagine that you have an embolus, which is a clot that is moving, right? You have an embolus, and that embolus get lodged right here. And imagine there was no connection, there was no circle of Willis, okay? Whatever blood vessel goes to the right side of the brain is going to go to the right. Whatever goes to the left side of the brain is going to go to the left. If there was no circle of Willis, all of the section of the brain right here, if there was a blockage, you would not be able to receive blood because of the blockage in this blood vessel right there. But now with a circle of Willis, excuse me, if I have a blockage right here, the blood is going to find a different route to supply blood to the region of the brain. So the circle of Willis is a protection mechanism to provide more than one route for the blood to go and reach the tissue of the brain. That is the purpose of the circle of Willis. Okay? All right, moving on, let's talk about the hepatic portal circulation now. And the hepatic portal circulation is special because it's going to include not one, but two different capillaries. We have a first capillary and we have a second capillary. Now, what is this first capillary right here? Guys, this first capillary is the blood that is passing through our digestive system. Let's face it, we all eat junk food. We don't eat just vegetables and broccoli and carrots, right? We also eat other stuff that we know is not very good for us. Now, as the stuff that we ate and is going to be digested and eventually is going to go into the large intestine so we can get rid of it, I have a question for you. Do we want all of that toxin to return to the heart, to the right atrium of the heart? No, we don't want that. Now, besides the toxins that we're going to acquire in the digestive system by breaking down the food that we eat, we're also going to have good stuff in there, stuff that we want to keep. We're going to have nutrients like glucose. And we need to find a place to store that nutrient, to store that glucose. This is where the liver comes into place. The liver has two different functions. The liver stores nutrients like glycogen, and the liver detoxifies the blood. So, after the blood passes through the first capillary of the digestive system, the blood is going to go through what we call a hepatic portal vein that connects the first capillary with the second capillary inside of the liver. What is the liver going to do? The liver is going to take the nutrients and store them. The liver is going to take the toxins and destroy them. So now the blood from the liver, from the second capillary, is going to pass through what we call the hepatic vein. And from the hepatic vein is going to enter the inferior vena cava and eventually return to the right atrium of the heart. Okay, so what is the function? What is the purpose of the hepatic portal circulation? Two, storage of nutrients and detoxification of blood. I love asking questions about this in the exam. Okay. How about the fetal circulation? Well, the fetal circulation is circulation of blood to the fetus. And that depends on what, guys? The fetus is connected to the mother through the placenta. So everything that the mom eats, everything, all the nutrients, all the stuff is going to go to the placenta and then eventually go to the fetus. Now, the placenta is connected to the fetus through what we call the umbilical cord. And the umbilical cord includes one vein and two arteries. What is the vein? The vein is the big one right here in the middle. Okay, why is we call it a vein? It's called a vein because it's going to take blood towards the fetus heart. Not the mother heart, but the fetus heart. Remember, vein takes blood back to the heart. And wrapped around the vein, we're going to have two arteries. And they are called arteries because they are taking blood away from the fetus heart, sending it to the placenta. Okay? Now, we all know that the fetus lung is collapsed. The fetus is not breathing on their own inside of the mother, right? They're not breathing on their own. They're getting the oxygen from the blood of the mom. So for that reason, folks, a fetus don't need to send the blood to the lungs to become oxygenated. In fact, the lung of the fetus is collapsed. They're not working at all. So because of that, a fetus heart have two different bypasses to decrease the amount of blood sending to the lungs because the lungs are collapsed. One of the bypasses in the fetus heart is literally a hole between the right atrium and the left atrium. And this hole is called the foramen ovale. Now, as soon as the fetus is born, the foramen ovale is going to close and it's going to become what we call the fossa ovalis. Now, it's just a scar tissue. If we open up our heart and we look in the wall, we can still see the fossa ovalis, where the foramen ovale used to be. Have you guys ever heard of babies that are born with a hole in the heart? That's what it means. It means that the foramen ovale did not close properly the way that it should. So that baby needs to have surgery in order to close the foramen ovale. The second bypass that a fetus heart have is that there's a connection between the pulmonary trunk and the descending aorta in the fetus. And this connection here is called the ductus arteriosus. So the blood can go directly from the pulmonary trunk into the aorta. Again, bypassing the lungs. Right after the baby is born, that ductus arteriosus is going to become a ligament called the ligamentum arteriosum. And now there's no blood vessel anymore. It's just a ligament holding the pulmonary trunk with the aorta. Okay? Any questions, guys?
We cut the umbilical cord.
Yes, we do. And finally, let's talk about the vital signs, pulse, and blood pressure. What is a pulse rate? Pulse rate is our heart rate. And we can check our pulse rate through several different superficial arteries that we have in our body. Okay, one of those arteries is the common carotid. It's very common, to check if someone is still alive. We can feel the common carotid and the pulsation through the common carotid. Another very important blood vessel that we use is the brachial artery, which we're going to use to check our blood pressure. Can anybody tell me what is a normal blood pressure, guys? What is a normal blood pressure?
120/80.
120/80. Why do we have two numbers? Because the 120 is what we call our systolic blood pressure. What is systolic? Systolic is when the ventricles contract and push blood into the arteries. So the pressure in the artery is going to go up. The more blood you have in the arteries, the greater the pressure. The lower number here, the number at the bottom, this is what we call the diastolic blood pressure. N is the pressure in the arteries when the ventricles refill with blood, when the heart relaxes. So systolic is when the heart contracts, diastolic is when the heart relaxes and refill with blood. Okay? Any questions, folks? All right. Now, again, why is hypertension so serious, guys? I can't tell you enough how important it is for all of you to check your blood pressure. You might be thinking to yourself, oh, I'm young and healthy. Uh, I'm sure my blood pressure is perfect. Wrong. I didn't know that I had hypertension. It wasn't until I switched my dentist, and now every time I went to my dentist, they checked my blood pressure, and they noticed that, wait a second, your blood pressure is slightly high. At the beginning we thought, maybe it was because I was scared of the dentist. Everybody's scared of dentists, right? When we're scared, our blood pressure goes up. But every time I went, it was elevated, and then I started to check my blood pressure at home and my blood pressure was constantly elevated. So I have what is called a pre-hypertension, which is an elevated blood pressure. Okay? What is so bad about having hypertension? Hypertension can lead to a hypertensive stroke in which a blood vessel can burst in your brain. Hypertension can lead to retinal hemorrhage, which a blood vessel will damage your retina. You're going to go blind. Hypertension can increase the chance of formation of atherosclerotic plaque, which could lead to a heart attack. Hypertension will develop in ventricular hypertrophy, in which your ventricular walls, your left ventricle will become thicker, decreasing stroke volume. Hypertension is going to cause damage to our kidneys, and hypertension can lead to the formation of an aneurysm, which is the enlargement and the bulging of the aorta. Guys, aneurysm is deadly. If the aorta bursts, you're dead in a few minutes. There's not even chance, not even time to go to the hospital because you're going to be losing a ton of blood. You're going to have hemorrhage. You're going to die. Okay? Now, what about hypotension? Well, hypotension is much less common than hypertension. Yes, if you have a very low blood pressure, this is also problematic because that means you're not having enough flow of blood through your body. Your heart is not able to pump blood everywhere, but it's something that is much less common than hypertension. Hypertension is very common and very serious. Now, what happens when we age? As we get older, our heart will literally shrink in size. Our heart will become smaller as we get older. What's going to happen to our cardiac output is going to go down. Our heart rate is going to go down as well. Unfortunately, our systolic blood pressure is going to go up. Every single one of us, as we grow older, we will be hypertensive. And our blood cholesterol also increases. And this is the perfect storm for the development of what? Heart disease. If you have an increase in systolic blood pressure, increase in blood cholesterol, especially low density lipoprotein, that is the perfect condition to develop heart disease and develop a myocardial infarction. Okay? Sorry, I always end the classes in a depressing note, but is a warning for all of us. We need to watch our diet. We need to exercise to keep our heart and our blood vessels healthy.
And low sodium diet.
Absolutely, because a high sodium increases hypertension. I have a question here from Janelle. What would happen to your body in hypotension? Good question. So hypotension is when you have low blood pressure, right? Low blood pressure means that the heart is unable to pump blood through all the different body parts. So usually what happens in hypotension, if people have like a hypotensive situation, they will faint. So they're gonna faint, they can be unconscious, and they could die if they're not getting enough blood, especially to the brain. Okay, so this is what can happen if you have hypotension. Any other questions, folks? All right, guys, another chapter in the books. So chapter 11 done. The quiz for chapter 11 is open right now. Go ahead and take it. On Thursday, we're going to start and finish chapter 12, which is also going to open the quiz for chapter 12. So you're going to have two quizzes due on Sunday, okay? And then next week, Tuesday, we have our second exam. I have a question here from Vanessa. Can someone naturally have hypotension? Yes. The same one that someone can also have naturally hypertension. Genetics. Okay. But if you're going to choose between hypertension and hypotension, you're much better served with hypotension, as long as it's not very low blood pressure. Any other questions, guys? All right, folks, have a great rest of your day, and I'll see you Thursday. Thank you.